Julie's in Cremorne. Morning, Julie.
Good morning, Macca. How are you?
Yeah, Cremorne in Sydney, yep.
Yeah, it's a bit cloudy here this morning.
Bit of rain around, I think.
Yes. Look, Macca, I was just listening to, as I always do, your show, and I heard a discussion about macular degeneration. And I happen to be the CEO of the Macular Disease Foundation Australia, and just so happened the week after next is Macular Degeneration Awareness Week.
Right. What date's that?
That's from next Sunday right through to the following Saturday, so the last week in May.
Right, so that's the 21st.
Thank you.
Yeah.
Thank you for that.
Yeah.
A bit early in the morning.
Yeah, it is. It's every Sunday's early in the morning, if you know what I mean.
And I listen to your show and I hear so many stories about people reading, the love of reading and driving. You know, they're out on the road. And, of course, macular degeneration affects your central vision. And I just thought this is too good an opportunity. It's been raised to say how important it is for people to have their eyes tested and not to ignore any changes in their vision, because this is a disease that affects older Australians, and it's huge. It's the biggest one that affects causes vision loss and blindness, and it is really debilitating, and I heard the story about the lady up near the television. The good news is that there's lots of aids and technologies now for people with low vision, and perhaps even Macca, the driverless car, will be a solution in years to come. But it's so important to be able to prevent this disease so we can keep on driving and see the faces of our loved ones.
And reading, the joys that you grow up with in simple things, you know, like reading and, you know, watching television, I suppose, but not so much for me. But reading and certainly driving is, you know, something that you can enjoy. But yeah, exactly right.
And we want people to be able to keep on doing those things. And one of the things that I find that people tell me, they say, look, I was out on the golf course and I noticed that the flagpole was sort of all wobbly, or the Venetian blinds was slightly bent. And I just thought, you know what, it's probably the glasses, and next time I go to the doc or the optom, I'll get that checked. And what I really need to tell you listeners is that you have a very small window of opportunity with macular degeneration for the wet form, which we can now treat and save sight. So, you know, don't ignore things. It's so easy as we get older. You know, most of you got a pain here or a pain there. I'll check it out sometime. But this with sight, you cannot delay. So, and there are lots of things that you can do. I heard the discussion about diet and lifestyle, and I think you spoke about keeping fit and walking. All of the things that are good for all of the chronic diseases, such as heart, are good for sight. It's for everything.
Yeah.
You keep your weight down, walk, don't smoke. Smoking causes blindness, causes macular degeneration. And get your eyes tested. Don't ignore changes in vision. And from the foundation, you can get a little toolkit. Just put it on your fridge. It's called an AMSLA grid. And you can test between visits to your optometrist for any changes in your vision, and it's all free. So we're very happy to not only try and help people prevent this disease, but for those who have some vision loss and blindness, there's some fabulous aids and technologies now. You know, the whole technological world has really come in to help us to be able to read. You know, the audio books, the way we can actually have machines in our house and just switch it, and boy, you can read 10 books at a time.
So, Julie, it's not reversible macular degeneration. That's what it is. That's the story.
Look, it's not. We can slow down the progression.
And that's obviously what our correspondent Joyce did.
That's correct.
By following some dietary things and a few bits and pieces, and I really always think it's physician heal thyself. When you've got a problem, you go to the doctor or whatever, but you need to read about it yourself, because it's the most important thing in your life, your own health, isn't it? So it behoves you to maybe get online or read a book, or if you can't read, ask somebody to find out as much as you can, because there are lots of people out there suffering from all sorts of things, and they might have a little insight too about, you know, what you can do and all those sort of things. But I think the diet and the exercise thing applies to everything, doesn't it, Julie?
It does, Macca. And, you know, I learn so much from the people that phone us at the foundation, and it is so important to have that knowledge. And
So should people ring the foundation, or should they go to their doctor first, ring their doctor and say, look, I'm having this, and then what happens?
look, the first thing to do is to have an eye test, whatever you're doing. But ring the foundation. Can I give out the toll-free number, Macca?
Yeah.
1-800 111 709, 1-800 111 709, and we have a free information kit, and that information has been approved by a medical committee that is led by Professor Paul Mitchell, the world's most eminent doctor in this area. So people can be assured that the information they're getting is accurate and evidence-based, and that they've got the good guidance that they need.
All right, Julie, good on you. Nice to talk.
Thank you very much, Macca.
It's a pleasure. Bye.